Assalamu alaikum. Mashallah, we've got Dr. Basil here who looks after the mobile medical clinic donated by the Salya family. It's been maybe 3 months now, 3.5 months.
3 months.
So we'll just find out about how much it's benefiting the people and what it's done. So if you can just give us a bit of an overview of how it's been after this was donated.
Alhamdulillah, as you know, like we started nearly about 4 months ago now, and slightly it was going up and down. The number of people depends of the weather really coming from the people who is coming from Turkey because they're crossing the sea and it's open sea, so it depends on weather. When it's less wind and calm sea, then we'll have a huge number, about 2,000 people coming every day. Yeah, every day. So, for example, yesterday we had 1,800 arrived here to the island. Yeah, we are expecting in the future to go the number to rocket up, to come back to 3,000-4,000 every day people arriving here. And alhamdulillah, we've been doing alhamdulillah very good job. For last month we had about over 500 cases, medical cases came to us, all different sources: asthma, hypothermia, high blood pressure, all different sources, flu, cold, sore throat because it was very cold days. So alhamdulillah, babies, we have meningitis as well. So we have lots of different issues. Alhamdulillah, we managed to save lots of people's life by your help, and Salya, alhamdulillah, help. Jazakumullah alf khair. May Allah accept your donation, inshallah.
So obviously the benefit of the mobile clinic is you can park it anywhere, you can take it anywhere, wherever there's a need. Why would this be better than the one that we've seen at the camp, which is a fixed kind of clinic?
Okay, we can't say it's better. It's this doing one job, this doing another job. Both of them, they complete each other. Yeah, because here we seeing people who's coming from the sea, we help them once they arrive to the mainland. If there's anything we can't drive, we're covering about 3 kilometers here on the seashore, South Seashore. So we're covering this area with anybody coming. So this is a benefit from mobile clinic. You can drive it anywhere, you can help them, you can restock it, or if they need transport to the hospital or anything, alhamdulillah, we managed to do it. The static clinic, because inside the camp there's over 2,000 people, they stay there for a few days and they are irreplaceable. So anytime when they're moving back to Athens, other people will come. Yeah, in the second day. So as well, was very busy as well.
Okay. And in terms of the benefit it's brought to the people, what how important has it been for this to exist so they can benefit the people? I mean, obviously, if this wasn't here, then they wouldn't have.
Exactly. Everybody knows, the economic situation here in Greece. For example, the whole island, there was only 2 ambulances. That's it, covering the whole island. Yeah, the other 5 or 6 ambulances being broken, and they don't have money to fix it. So we, by our presence here, we reduce the number of people who is gonna go to the hospital or be transferred to the hospital, where we can see them here and we can help them here. And as I mentioned before, it was really life-saving. Many cases of chest infection for babies 3 months old, or asthma for pregnant women, different cases really. But alhamdulillah, we managed everything, inshallah.
Okay. And in terms of numbers, obviously it depends on how many boats come in, but on average, if you look at the past 3 months, what would you say on a monthly turnover of patients would be roughly?
As I said, in the past, when we started, because it was extremely busy here, we've seen about over 1,000 patients per day, but there was every day coming around 5,000 to 7,000 people coming to the island. When it was summertime, yeah. Now because it was winter, so the number dropped down dramatically, yeah. but we expecting like start from these days and until end of August or end of the year, the number will be go again up again.
Yeah. And in terms of what you carry on board with regards to the medicines and supplies and stuff like that, just sort of.
So we have all the emergency stock for any life saving or any medicine. Yeah? So we have the adrenaline, we have the atropine, we have the antibiotics, we have the painkillers, we have all the different sources of medicine which been stuck.
Whole collection basically of the main
exactly
medicines.
Yeah, as you see here we prepare like this oxygen.
Yeah.
If somebody needs the oxygen, yeah, this like as well, like to have antibiotics, different sources of antibiotics, yeah. And we have here the other side, it's all stuff like vitamins, so we try to keep it tight here really. Yeah, as much as we could, because we are always in a move. Yeah, as you see. So alhamdulillah, it's always like we in stock and we helping people. We have the mobilizer here, the Ventolin, insulin as well, because some cases they arrived like they've been suffering from diabetes and suddenly they have like very high, yeah.
I think the mobile medical clinic, I mean, it gives the patient privacy as well in terms of the.
Exactly, this very important as well, because you know, to give them the privacy where they can they talk about what they have or what's suffering from, so you can't see them in the street somewhere. Outside.
So you have.
And we have like a few doctors been working with us, like Dr. Osama as well. He's Syrian originally, lives here in Greece, and alhamdulillah we have lots of people
You kind
coming in.
of juggle it between you guys to try and cover as much as you can.
Exactly, inshallah. Yeah.
So it's obviously we can see that it's really benefited. You know, first and foremost we thank the Almighty and also Human Appeal for giving us and the family an opportunity to do this. But you guys are doing a great job. Jazakallah khair. May Allah accept of you guys as well. Make dua for the family as well, that Allah accepts from them and give them barakah and bless them as well, inshallah.
Wallah, jazakumullah alf khair, may Allah accept their donation. You are really, guys, Salya family, you saved lots of people's life by your donation. May Allah accept your reward, and inshallah we are looking to continue your support and working together inshallah for next 6 months if we could, inshallah.
Inshallah.
Jazakallah khair.